We'd like to congratulate executive producer Andy Stout on City Chat's 20th episode and bringing talk shows into CTV studios. As kids head back to school, daycare, college, it's important to make sure that their vaccinations are up to date. Today on City Chat, we are delighted to have Health Commissioner for the City of Columbus, Dr. Mashika Roberts, to join us today to talk about the importance of back-to-school immunizations. Thank you, Dr. Roberts, for coming into our studios. We're so excited to have you here.
Glad to be here. Thanks for asking me.
When people talk about back to school, there's this huge buzz about vaccinations. Could you tell us why it's so important?
Well, vaccines are always important year-round, but when we think about kids going back to school, no matter what their age, we worry that when they're in close confined quarters like a school, there's a greater risk of transferring communicable diseases or infectious diseases. And that's what vaccines are made for, to prevent the spread of communicable diseases.
What are some of the required back-to-school vaccinations?
Well, there's several. It really depends on the child's age and what grade they're going into. But here in Columbus, some that I can mention are DPT and Tdap, polio, hepatitis B, measles, mumps, and rubella, also known as the MMR vaccine, varicella, or chickenpox, and meningococcal, especially for college-age kids.
I don't know any of those vaccinations. Are they, they're just specified to a specific common disease, or what?
Yeah, so we're looking at the polio disease you've probably heard of. We haven't had any cases here in years because of the effectiveness of the vaccine. Hepatitis B is a virus that can infect your liver, and it can be transferred from blood products as well as from feces, and so that is a concern. Then measles, mumps, and rubella, you've probably heard a lot about in the media lately, and so that is something that is required for kids to enter school unless their parents choose to refrain from getting it, and they do have that choice here in the state of Ohio to opt out of these vaccines. And then DPT and Tdap, that stands for diphtheria, polio, and tetanus, pertussis and tetanus, and those are, particularly pertussis is a very common disease that we see a lot of outbreaks in our school systems.
Why are some people allowed to opt out from a vaccination? Like, isn't that kind of endangering everyone else?
Well, from a public health standpoint, it is putting other people at danger, but that is a choice that the state has made, that people can back out for medical reasons. Some people have very compromised immune systems and are unable to get some of the live vaccines. Some of these vaccines are live, and so they can opt out. And then also in the state of Ohio, you can opt out for religious reasons or for just personal reasons. You can opt out as well.
What would you say are the most important vaccines, and is there like an official list of what the most important vaccines are?
So again, all vaccines are important, but I would say right now, given what we're seeing across the country with measles outbreaks, the MMR vaccine is really concerning and very important. It can be a very deadly disease if someone were to get measles and they were unvaccinated. We know that nationwide we've had over 1,000 cases of measles in our country, and that's concerning given the fact that in 2000, the year 2000, we declared that this disease was over, and now we're having multiple cases across the country of measles. So the MMR is very important, but in terms of an official list, again, it really depends on the grade the child is going to, and so that's something you should talk to your school nurse about or your medical provider.
The vaccinations that are most important, even though they're all important, but is it dependent each year? Do they measure what vaccinations are necessary?
No, so the vaccination schedule and the recommendations actually come from the American College of Physicians and immunization experts, along with the Centers for Disease Control and Prevention. And so they have a great table that spells out at every age what a child should be vaccinated for. And then different states can have variations in those recommendations. But in general, we're following the guidelines of CDC and the American College of Immunization Practitioners.
That's great. Where can we get vaccinated?
So, vaccines are readily available at most medical providers. So I would say first contact your medical provider. You can always come to the health department. We offer it there. And then you can also go to retail outlets. I will caution some parents that some pharmacy or retail outlets, whether it's a grocery store or a pharmacy, might not vaccinate very young children. They might have some limits into how young they can vaccinate, but definitely your healthcare provider and your local health department can provide those vaccines for you.
What are some of the tips to stay healthy this school year?
Well, I'm glad you asked that question. So in addition to getting vaccinated, which I think is one of the #1 tips that parents can do to help their children stay healthy and safe this school year, we always remind people when they're going out in crowds and to schools to practice proper hand washing. So making sure you wash your hands before you eat, and after you've touched anything that could have contaminated your hands. If you don't have access to running water and soap, then hand sanitizers will work as well as a backup. Also, I would make sure that your kids get enough sleep. It's important for them. That's part of their health, to get rest every night, and then it empowers them and gives them the energy they need to power through the day at school the following day. Making sure they eat a balanced diet with fruits and vegetables is also important. They should have at least 5 servings of fruits and vegetables every day. Drinking plenty of water. What we say in Columbus Public Health is water first for thirst. That's the important thing. And then we want to make sure they get up some physical activity. And so that usually happens at school with recess, but kids should make sure they get at least an hour of play a day. And I know that seems like a lot. It doesn't all have to be at one time, but an hour of play a day.
We are so excited to have you here on set, and so we just wanted to give you the opportunity to talk a little bit about your passion behind all of this.
Sure, well thanks. I've been doing public health my whole career, and I absolutely love it. I love being able to make a difference in people's lives of all ages across the spectrum, as well as in our community. So at Columbus Public Health, we're working hard every day to improve the health and well-being of everyone in our community, as well as protect their health. Some important issues we have right now that we're dealing with, obviously, is making sure our community is safe from the measles, so making sure the measles vaccine is available to anyone who wants it, working really hard with our partners at Celebrate One on infant mortality, as well as working with our partners on the community around violence, particularly leading the Violent Crime Review Group, and then working with other partners across the county with the Columbus and Franklin County Addiction Plan. So we're busy, but we like it that way, and again, our goal is to make sure we protect health and improve lives of all residents here in Columbus.
Thank you so much again, Dr. Roberts, for coming into our studios today.
Glad to be here, thank you.
Columbus Public Health has an immunization clinic at 240 Parsons Avenue that will have extended hours during the back-to-school rush. Learn more at our website, www.columbus.gov/publichealth, or by calling 614-645-7945. If you have questions about vaccine requirements, you can contact Columbus Public Health or your school nurse. Thanks for watching City Chat on CTV.